Good evening. Thanks for being here. I know it could be at the end of the day for some of you. Sometimes it could be at night for some of you and you had a hard day. I'm so looking forward to hanging out with you for the next hour and talking about composites, one of my favorite things to do. I got a bunch of before and after slides, and I want to get through them all. So let's go. First, I want to say thank Curare because they sponsor a guy like me sitting in my office doing work every day. And I looked at their material. I use their materials every day. So this is a company that I love to hang out with, and they do better things, and they support little guys like me. Well, the state of affairs in general dentistry is if you open up a magazine or you go to your favorite forum, everybody's talking about implants and scanning and digital treatment planning and printing and all these new fad things. But I could tell you one of the things that you don't hear about is that single tooth dentistry. And that's what I love to do. What about the old school kind of bread and butter, everything that we do every day? We can talk about, printing, but, if you're not doing good at that bread and butter stuff, I think people lose the love for this type of dentistry. And I haven't, and I'm 27 years into my career, and I can't wait to do the next filling. So hopefully you'll see my passion in my composite fillings and the way that I do things, the way that I love on people. And I hope you'll be more passionate about it after the next hour. Arnold Palmer used to say, for a lot of players, golf is a way of making a living. For me, golf has always been a way of being alive. And that's kind of the way I feel about dentistry. And I'm just passionate about it. And I want you to be passionate about it. And I want you to love dentistry 27 years after you graduated as well. So let me hopefully get you excited about kind of bread and butter stuff. I'm going to challenge you today. You are definitely going to be like, wait a minute, what did he just do? You're going to be like, I don't believe it. Okay. But I'm going to challenge you to think outside the box for the next 50 minutes. Okay. And so I'm going to leave my email address at the end of this thing. And I want you to email me, and then we could talk. And I promise to reply to you in the next 24 hours. Okay. So let's get started. All right. This woman walks into my office. She is 45 years old. And I look at her, and basically the two of us have decided that saving 3 teeth is probably not in her best interest, right? Could we save the other 3 with root canals, post and course, and crowns? Yeah, but there's a reason why she's in this position here, is because she doesn't have that kind of money. So we have decided to do a full denture on the top and a partial on the bottom. But in my office, when you do an immediate denture, it's hard to take her teeth out and then let her wait for 8 weeks for everything to heal. And she doesn't have enough money to do maybe an immediate, and then we wait and do it again. So what we've decided to do is just try to save her teeth until she's ready for a denture. So I spend about an hour, and I restore kind of the nubs left on her. So now we can go ahead and extract the posterior teeth, let her heal, and then to do an immediate that's a lot more, the one that's probably going to fit a lot more exact than if I just threw in a denture on the day of the extractions. And this has been 4 months, and she's still in the process. So all these things have lasted. And the way I know this has lasted, so this guy walks into my office about 10 years ago, maybe 4 years ago, and he didn't want a denture, and he was a family member of one of our staff members. So we decided there's a reason why he hasn't come into us before today. And so let's try to save his teeth. I know it's a little bit of a reach, but let's try to save his teeth till he's ready. He's a gagger. So I was going to put him in a partial to kind of just get him used to maybe a denture later on. So this is the prep that I did. There is nothing here to hold on to, but we're trying it. Okay. So these are the kind of things that I do in my office. Why not try it? So we're going to try it because he's a family, a friend of He's a family member of a staff. I can probably, stretch it a little bit. So we do the restorations. They're not perfect. Even the midline's off, right? But this is something I did freehand in about an hour and 20 minutes. Okay. Then we go ahead and make his partial. We went ahead and restored the lowers. Everything was great. And he walked out of the office. I never saw him again. So, at the 3-year mark, I didn't want to talk about it because in my mind, I'm thinking they're all gone, right? And he's just walking around with nubs. But I asked Ashley, my front desk person, if she's heard from Uncle Gary, and she said she hadn't. So I said, reach out to Uncle Gary. I'd like to know how many teeth are still there and how he's chewing or whatever. So Uncle Gary calls and he says, I still have all my teeth. And I was like, wait. And I looked in his progress notes, and this is what he came back in to get his teeth cleaned. That's 3.5 years. Everything is still there. Now, Uncle Gary obviously doesn't take care of his teeth. Uncle Gary no longer wears a partial. So he's chewing on those 5 teeth for the last 3.5 years. And I hope you remember what the preps look like. There was nothing there. So this is kind of going to be the theme of what we do for the next 45 minutes. Now, when art meets science, I love art and I love science. And so like when I look at a photo, a painting or a masterpiece like this from Rembrandt called The Return of the Prodigal Son, you guys may know the story, but there's a son, there's an older son, there's a father, and Rembrandt has put himself in this masterpiece. He has drawn himself in this masterpiece. And so everything we do at Gamicia Dental is we make masterpieces, and everything we do has our signature on it, has our face in it. And so here's Rembrandt. This is the descension from the cross, and here's Rembrandt in the crowd. And so he puts himself into every story. I was just able to go to the Louvre, and I learned that Diego Velázquez did the same thing. So here's Diego in his masterpieces, and here he is in this masterpiece as well. So remember, what we do in our office every day is put our face into things. So I don't know about you, but I love putting my face in my masterpieces. So everything that I do, you're going to see my face in it. You might not see my face, but you're going to see my signature. Everything I do has beautiful anatomy, or at least I try. And that are things that I'll be proud of if they actually ever went to another dentist and moved away, and another dentist saw that my work, I do not like my work out there without a signature on it. Okay, so even the mundane, the class 2, this DO on number 30 has my signature on it. Everything that I do, great contacts, great anatomy, great polishing. So here's a third molar, right? That has an occlusal buccal filling on it, a very large occlusal buccal filling. You say, why would you ever do a third molar? Well, this person, I'm going to show you like a 9-year post-op after they had orthodontics and brought that tooth into play. Okay, so we kept that tooth for a long time. Every bread and butter stuff. So the first maybe 15 minutes of our lecture is just going to be kind of like bread and butter, class 1s and class 2s. All right. So I love every day. I love it. This is the kind of thing that we're going to talk about in the second half. And I am probably a lot like you. And this person walks in with an old MOD amalgam in it, and the lingual cusp broke off. And you say to them, well, you're going to need a buildup in a crown. And that is somewhere in the range of $1,800, maybe $1,500, $1,200, wherever you're at. And they say, well, I can't afford that. How much is it to just take the tooth out? And that's the real world. That's the world we live in. And so I say to them, look, let me go ahead and do a composite restoration and see how long this thing lasts, and see if we can kind of kick the can down the road a little bit. The problem is I kept seeing all these tries or whatever, let's just try it. And I kept seeing them 5 years, 6 years, 7 years, 8 years down the road. And the person had never done, a fixed restoration, and the composite's still looking great. So my philosophy started to change a little bit. And I'm going to warn you a little bit. We're only going to talk about philosophy in this lecture. And that's because I don't have time for technique. Okay, I'm going to do a little bit of technique, but I really want you to just sit back and see the possibilities of what we can do with composite. And it doesn't have to have beautiful anatomy to be a perfect restoration. Like, I don't even know where this restoration is. I know it's an occlusal. I can't see my margins. But I love doing complex restorations almost every day in my office. Okay. So here, like, it's not that hard to say that this person needs some new restorations. And so in my office, I would probably schedule somewhere in the range of 30 minutes to do 2 of these, take the old one out, bevel the prep, and just restore. And in less than 30 minutes, this is the kind of work that we can do in my office. Yeah, I'm so proud of these things, and I love doing them every day. You'll keep hearing me say that. Okay, who the heck am I? I am a husband first, and I'm a dad. These are my 4 children that I'm super proud of. My oldest is a second-year dental student at the University of Florida. My second just graduated from the University of Florida. So there's a lot of Gator blood in my family for sure. My office is a standalone office in a suburb of Orlando. Don't think that I work on all the Disney people. I'm about 50 minutes from Disney. So I'm in a little small town outside of Orlando. And that's what my office looks like. Here's my reception area. I'm very proud of my office. And here's kind of where I work every day. It's just nothing too fancy. Just kind of small, not quite small town, but pretty much small town dentistry. I know everybody that walks into my office. And, you're going to see a lot of this. And this is like an 82-year-old man that came in with like a 60-year-old amalgam. And so I know things last in his mouth. So I just said, I probably did not even anesthetize him. Because there are studies out there that say anybody over 70 years old, they feel less than 11% of their dentistry. That study is out there. So if you can take this amalgam out, set a lot of secondary dentin, and just replace it, this is easy. This is a younger person. I do not love doing fixed dentistry on this person. I do not like cutting their tooth down to do an onlay. Even if it's a half a crown, I do not do it. I will restore this with composite every single day. And it looks a little bit like that. I stand on the shoulders of greatness. I saw Ray Bertolotti in 1995 for the very first time, and I've probably seen him 10 times since then. And you probably know some of these others. Ray Bertolotti, they call the godfather of adhesive dentistry. He was doing crazy stuff way back in 1995. And once I heard him talk, I was hooked. He called himself a bondodontist. Jason Smithson got his start like Dental Town. He does some amazing work. Pascal Monnier in California is amazing. What an amazing person. David Allman started the Academy of Biomimetic Dentistry, things that people that I like to hang with. There's Dr. Bertolotti and I. He was in the audience of a class. So this guy's still going to class. This is Jason Smithson's work. You think I got this upside down where you think, well, here's the virgin tooth, and then they did a root canal, and this is the access. No, this is the access. This is after root canal, and this is the restoration. Jason Smithson is an artist. Now, I've seen his lecture, and this occlusal filling takes an hour and 20 minutes. So that's not quite the real world for us, because we're going to be fairly efficient with our time. Now, you say, what is the obstacles for this kind of dentistry? Well, for me, talking like, what is my obstacle? Well, first, it's money. Here's a little clip for you. Let's see if this will work. Show me the money. Yeah, okay. I'm just keeping you on your toes. All right, so Sinclair said it's difficult to get a man to understand something when his salary depends on him not understanding it. I know a lot of you think that you can't make money doing fillings. Well, I would disagree. I'll just say that I'm a fee for service dentist, and I recognize that not all dentists are fee for service, but everything that I'm going to tell you is through the lens of a fee for service dentist. Okay. And I recognize insurance plays a big part in your work, but not in mine. So there's a study from the ADA that talks about production. And in 2018, study came out saying, X, the production of the 75th percentile dentist was X. And, this is how I see how I'm doing next to other dentists. Well, I was doing 29% higher in production than the 75th percentile dentist. And I was like, oh, okay, well, I called my ceramist and I said, how many fixed units did I do in 2018? I did 58 fixed units. So crowns, bridges, all that counts up. So I was doing 1 crown a week, and I was 30% higher in my production than the 75th percentile dentist. So I'm proof that we can do it, that you can do this. All right. So here are 3 fillings that this person has a 2:00 appointment. Okay. And we are going to work. We're going to say hello. We're going to get them numb. We're going to talk, ask them about their kids. We get started. All right. So these are decent preps. So I cleaned them up after this. And it took me about 9 minutes to do all that. And then I go through all my steps. We're not going to talk about these today, but I go through all the steps. And me and my assistant are pretty doggone fast at doing this. After the restorations, the first draft of the restorations, about 20, 25 minutes to do 3. And then I put my anatomy in, I finish, I polish, I check occlusion, and this is what it looks like. Okay. I took the time, and that was 43 minutes. So those are fairly straightforward, but you get the idea. I'm not allowed to talk to you about my fees because the government says we can't talk about fees. But I can tell you somewhere in the range of $275 each. Okay, so 2 surface resins in the range of $275. Okay, so in 43 minutes, that means I'm making $11.50 an hour in the range. Okay. So let's talk about a crown. So we'll talk about crowns, maybe 60 to 90 minutes for a preparation, right? Plus 30 minutes for your seating appointment. That's about 2 hours, maybe 90 minutes, somewhere in the range. You get what I'm trying to tell you. And let's say I charge somewhere in the range of $1,400 a crown. Okay. You got to take your lab bill off at $250. Okay. Your overhead's a little bit more with obviously crowns, and that's $11.50 for 2 hours. So you're getting what I'm saying here, that I'm making $11.50 an hour doing 3 restorations, and I make $570 an hour for a crown. All right. So I'm saying, all right, so let's just say, okay, we do 2 fillings in an hour or 2 fillings in 40 minutes. That's still $825 an hour. But let's say you do 1 MOD in a half an hour. And let's say you charge somewhere in the range of $325 for an MOD. That's still $650 an hour. So you're still, so the numbers add up. Okay. So as long as you're efficient at doing them, and I got to tell you, people come back to me because I'm a conservative dentist. Okay. So the next objection you might have is they don't last. Okay. Well, we used to talk about whether they last as long as amalgam is, but that just is not an argument anymore, because I just don't think we do amalgams anymore. The dental school doesn't even do amalgams. I teach at the dental school once a month. I don't ever see amalgams. So it's not really an issue. But there are studies that say basically amalgam and composite are failing about the same rate. Okay. McCracken said that in 13. This guy here is a big Optum is a big research guy, and he says basically large amalgam restorations show a higher survival, composite restoration show a higher survival rate in the low risk patient. Okay, so they are surviving. There's research out there. They followed a guy for 22 years, and they checked all his fillings. So he had 362 fillings that they watched for 22 years. Basically, at the end of it, he had 49 that needed to be replaced. 49 out of 362 in 22 years. That's the kind of stuff that I want to do at my office. So yes, I want to say they last. Here is a 3.5-year restoration that I did. I mean, that looks like the day I put it in, other than the coffee stains. Here's a 5-year recall. Here's a 7-year recall. Obviously, I'm showing you some of my best stuff, but this is what I look at my recall every single day when I'm checking hygiene. Here's that third molar that I pulled, that the orthodontist did his best to pull this in. This is an 8-year post-op. The stuff that I do, this is a 7-year post-op. This is the one you saw when we were talking about masterpieces. I saw this person today, okay? And it is 22 years old, but that photo is 20 years old. There's an 11-year-old filling, okay? This woman is a snowbird, came into my office with a broken tooth. And I said, let me put a build up on it today. She was leaving for Michigan the next day. I said, let me put a build up on it. When you come back after the summer, when you come back in the winter, we can do a crown. She said, okay. So she came back. She said, I like the filling. I don't want to do a crown. So we did that every year. Are you ready for the crown? No. Are you ready for your crown? No. So after 12 years, this was the buildup. This was the core paste. Core paste is not supposed to be an occlusion. And here it is 12 years later. She went to Jesus with that. She died and never got a crown. All right, here's an 18-year-old MOD restoration. Okay, you get it. They last. They last in my hands. 15 years old, 18 years old, 24 years old. Okay, I have these are two 24-year-old restorations. I just took this picture last week. All right, so I am pretty good at doing composites. So here's some of the things that I use. You got to have a superior bonding agent. Okay, I don't care which one you use, but don't use the one you get in the mail. Do some research, find out which is the best ones. For me, in my hands, it's always been Curare products. Okay, so here's a bonding agent. SE Bond is one of the top. Let's talk about some what's inside the tooth here and things that we will be talking about later on. So you have your enamel layer, you have your caries infected dentin, you have your caries affected dentin, okay? Your pulp, your dental tubules, okay? And we don't have time to kind of get into what dental tubules are, but the closer they are to the pulp, the more wet they are, the less minerals they have. The closer you get to the pulp, the lower the bonding strength there are. So having good margins on clean enamel, on good dentin is imperative. I want to talk to you about MMPs, and we're going to talk really fast, okay? MMPs are what break down your bonds, okay? So here's a study, and I read the whole study. I'm going to tell you briefly what it says. Collagen, there's MMPs in every tooth. They're in our collagen, but they're covered in crystals, so they're inactive. When we cut into dentin, we have inactive MMPs, okay? But when we etch collagen, it releases the MMPs. So us doing the filling, the process of adhesion starts the MMPs breakdown, these proteinases breakdown of your bond, okay? It's bad. Etching is bad. They found that chlorhexidine, if you wipe the tooth with chlorhexidine before you use your primer and bond, it's an inhibitor of MMPs, okay? But then they found there's other things other than MMPs, other than chlorhexidine that will inhibit MMPs, okay? That's a lot. But there are things we can, and what Curare took was MDPB, and figured out that this is also an MMP inhibitor, okay? And they put it in their primer of their SE bond. So wait, so you're telling me they put an MMP inhibitor in SE prime. Yes, they did. And what they call it is SE Protect. So you have an MMP inhibitor in SE Protect primer, and you have fluoride in the bonding agent. This is a superior bonding agent. And I tell you that because I'm pretty sure most of my stuff lasts as long as it does because of this product, okay? What you're going to see here is the day they put it in, it's at 17.9, but a year later, it's at 18.6. The MMPs have been inhibited, and their bonds, their gold standard clear fill is 21 to start, but 13 in a year. So SE Protect, I use everything that I do. I use SE Protect. All the resins are kind of moving to nano hybrids. Let's kind of move through this pretty fast. They are clusters of silica. And so it bonds really well. It finishes really well. It's durable. It's strong. So anything with it that's a nano hybrid, okay, moving forward in your composite. And I'll tell you, Clearfill Majesty ES is what I use every day. Okay, I use it on anterior, posterior. It polishes well, it handles well, and it holds up really nicely. You got to have a good contact ring to do great class 2s. Most people know this, okay? But these are the rings that I use every day. I use the V5 rings, the Triodent rings almost exclusively. The sectional matrix bands, super important, except that I was having to use my hemodents to pull them out. So what I did was I started using these Teflon tape coated bands, and they're super easy to get out. You got to use your loops. You got to use your lights. I use caries detector on every single thing every time I cut into a tooth, I use caries detector. Real quick, I use an air only syringe. Okay. So if you're going to blow air with this baby right here, the first thing that's going to happen is you're squirting water out of that. So I eliminated that by using an air. I paid $80 for him to put it in. And so I have, if I want to use air, I got my air only syringe. Curing lights, wicked important. Okay. So look, humor me a second when we talk about curing lights. Okay. It's indisputable how the properties are better when you are cured, and indisputable that you're not maximizing your restoration if they're undercured. They did a study, 37% of all restorations are not adequately cured. If you're not using a light that's expensive, I'm not necessarily saying expensive is good, but don't cheap out on your lights. Okay. I use a Valo X, which is the updated Valo Grand. Valo Grand's awesome. I use a Valo X, which is even better. Okay. They say the minimum should be about 1,000. Test your lights. People, test your lights. It has to be over 1,000, but we really want over 1,500 to 2,000. If you're under curing, you are making your restoration weaker. Okay. It's not going to last as long. You're going to get secondary decay, all that. So is your light good enough? Well, they did a test. They tested 130 lights. 46% of them needed to be replaced or repaired. 46%. Is that you? So let's talk a little bit about lights. Who puts it on the tooth? What direction are you putting it on? If you put it on a 45-degree angle, if your assistant is curing your light and you're not paying attention and she's not paying attention, you are losing energy. This is super important. I did my own little test with my old Kerr light back in the day. It got about 1,200 megawatts per centimeter squared. And when I bent it a little bit, and I lost almost 25%, 30% of my light. So I took the Valo and I did the same thing. Valo really kicks it up a notch. But if you do it at 45 degrees, you're almost at half the power. Okay, pay attention to that. You got to have a good assistant. You got to take photos of your work. Okay, this is a cell phone. Everybody's got a cell phone. I take pictures with my cell phone all the time. Show your patients your masterpieces. I use these dry tips for my isolation. I love them. I thought I'd just tell you about them. So let's do some more cases together. This is what an isolated, perfect restoration is starting to look like, okay? I'm not going to go through any of the techniques. One thing I did want to talk to you about was after you etch and rinse, what is moist? They keep talking about don't dry it out, but make sure it's not too wet. Let's keep it moist. What I'm doing from now on is I take the suction and I wave it over the tooth. The high volume suction, I wave it over the tooth, and that'll keep it moist. I do not blow air after I etch. and before I put my primer. Okay. Then all the layers and the steps. Okay. And this is the kind of restoration that leaves my office almost every day. Real quick, the burrs, I have 6 burrs in my composite kit. I use a carbide 330. I use a round burr, and then I use basically a prep burr to kind of finish all my margins. When I restore, I love this 2-striper from this football burr with a nice tip. There's a company called 2-striper. And then I just use a veneer polishing burr for my intricate anatomy. And all my polishing, 100% of my polishing, when I polish a tooth, brownie point, about 50% I'm using Slowfix discs, okay? And the discs are really for your class 2s. Let's just do another real quick case together, and then I'm going to start talking about bigger things. Once you know how to do restorations like this, now we're going to go, I'm going to start just making you uncomfortable, okay? And we can do this kind of thing with primary teeth. We can do awesome restorations, sorry about that, with primary teeth, okay? And everything we do, we won't talk about pulpectomies or pulpotomies or whatever. I just wanted you to show you that I do this kind of work with everybody that walks into my office, okay? And I stretch the limits of composite. So I'm not doing stainless steel crowns in my practice anymore. I will do complex composite restorations on primary teeth as well. So you have a DO, you have a DOL, and a beautiful sealant. That kid and mom are super happy. Great sealant, occlusal, a DO. Beautiful work. Now, does it last? Well, what I did was I told the kids, if you bring this tooth to me when it comes out, I'll give you $10. So kids don't forget these things. So I have hundreds of pictures of teeth that are exfoliated with my resins in them because, and I had to write a lot of checks too. So what about root canal teeth? So basically, I've changed my philosophy on post-endo restorations. If the tooth did not need a crown before I did the root canal, in my mind, it doesn't need a crown afterwards. Does a root canal weaken the tooth? Absolutely it does, but I don't think enough to have teeth start breaking after restorations. All right. So you have people that can afford a root canal, and this 24-year-old couldn't afford the crown. So this is kind of how my philosophy got started. Okay. This tooth does not need a crown. This tooth needs a buildup inside and a restoration on top of it. Okay. And here's some 9-year post-op of this is the day I put it in, and here's 9 years. Okay. I do stuff like this all the time. In fact, daily. Here's an access filling after a root canal. Here's an access filling after I did a root canal, basically an MOL, pretty much the whole tooth. This is what it looks like 7 years later. And I know sometimes you're feeling like I'm taking money out of your pocket by being conservative. It will pay off. It will pay off. Trust me. I have a practice that is full of these things, and I don't have to do crowns on all the root canals. Okay. Trust me on this. All right. So now let's talk about deep restorations. This kid and his dad came in. He was a first-year medical student. And his dad says, I just went to, the local DSO down the street. And they said this 22-year-old kid needed a root canal, a post and core, and a crown. And I said, let me do it. And I did this restoration in 25 minutes. Okay. And on the other side, he went to the same DSO, and they said you needed 2 more root canals, post and core, and crowns on a 22-year-old young man. Okay. I did 2 complex restorations, and he was out my door in an hour. Okay. But don't trust me. I want you to listen to Dr. Bader from North Carolina in 2014. So let's listen to what he has to say. Maybe. Here it is.
Doing it yourself. Radiograph associated with the patient sitting in your chair. I ask you, what might you start anticipating you might have to do? A pulp cap, a pulpotomy, perhaps endodontic treatment, other referral, or doing it yourself. But if the patient has a deep lesion such as that one half the dentin thickness or greater, but no signs of irreversible pulpitis. And that means it's positive to a cold test, it's negative to percussion. There's no spontaneous pain reported by the patient and no periapical lesion evident in any radiograph that you have. Then the science, the evidence suggests that you ought to consider incomplete caries removal.
All right, incomplete caries removal. That means if they have a vital tooth, you can take the decay out. You don't have to take all the decay out, and you can do a filling. So I'm going to start buzzing through these things because I'm running out of time here. All right, I want to get through this. He says, they used to do a two-step where you put, your calcium hydroxide and then your IRM and go back in at 6 months later. He says a lot of the failures will happen the second time you go in. What he says, if you do incomplete caries removal, the science says 1% failure. Okay. So things like this on this premolar on the bottom look like this in my practice. Every single time I see a large restoration, I ask the patient what their symptoms are, and I do a vital pulp test. And if it's vital, I'm doing fillings all day. I'm doing these fillings all day long. And, as like this one, this is a non-restorable tooth, basically. I said, let me throw resin on this and we'll see how long it lasts. Okay. So this is a gorgeous looking restoration. And I think this is going to be able to keep this tooth for a while. All right. Just very large, very deep restorations. Sorry about this x-ray, but this is what they brought me in. This what happened with this person has almost no decay in his mouth, but he didn't take his third molars out. So that third molar caused that decay there. He has no pain and he didn't even know it was there. So I'm going to do a restoration that looks something like that. Yes, there's a conversation that's had with them. There's a possibility they're still going to need a root canal, but every single time I do it, I do this. This is a young person, less than 14 years old. And I save this tooth from a lot of dentistry. Look at this decay up here. A lot of decay. This person doesn't even have his second molar in yet. Saving this tooth. And this is what that restoration looked like. Saving these teeth. Look at this big old restoration. This big old cavity here and big old cavity here. Every day I save teeth from root canals. Here's a 5-year post-op of that big one. Here's an 8-year post-op. Okay, I do it every day. I have a conversation with the patient that your tooth might die, but I only send about 1 or 2 people a year to the endodontist. So we talked about deep restorations. I use concave matrices. I no longer use a regular Toffelmeyer band. And I use a Contact Pro sometimes to help me with the contact. And the way it works is you can push on the instrument and cure through it at the same time to get you a good contact. So when this person walks into my office who's 24 years old and they broke the lingual cusp out of that second molar, and that's the only reason why he comes in. And I tell him he needs a root canal and a post-and-core, and he's like, I can't afford that. So I start taking all the decay out, and I feel fairly comfortable doing a composite restoration in a tooth like this. And I do it every single day. And it only took me an hour to do all 3 of them. This person walks in, same kind of thing. They cannot afford an onlay. They cannot afford a buildup in an onlay. So I'm very comfortable doing composite restorations on people like this. Okay. And sometimes I might even say that what you need is composite restorations. I won't even give them the option of onlays. Okay. Do a little electrosurge and restore these teeth. In the deep part, yes, I'll put Vitribond down there, a glass ionomer. So here's this restoration the day I put it in, and here's this restoration after 9 years. You can't use a regular Toffelmeyer for this. You got to use your concave Toffelmeyer, and you got to use your Contact Pro. And this is what it looks like the day I put it in. Sure, I trimmed this composite off, and this is what it looks like almost 10 years later. I showed you this one. This person was having trouble eating because she had 3 amalgams in her mouth. I said, let's replace the amalgams and see what happened. So when I went in there, I took the amalgams out and the lingual cusp literally just fell off. So instead of telling her she needed a buildup in a crown or a buildup in an onlay, I just went ahead and did the composite restoration. And so from the time that took the 2 pictures was 24 minutes. Very efficient in the way we do our restorations. Okay, I'm going to kind of buzz through some of these. Yeah, this is, like I said, I'm going to make you uncomfortable. This is an 84-year-old man who had a lot more problems than this broken tooth. This was the only decay in this tooth. He had an MO that broke out the buccal cusp as well. I took the decay out. I did some electrosurge. I put a band on it. I restored it. And it's a beautiful restoration. It took 21 minutes. And he's super happy. He so much came back and did all the other dentistry he needed to do. Here's an 84-year-old minister, was a retired minister, and he was told that he needed 2 buildup and crowns. He could not afford $3,400 worth of work. Okay. So I took the amalgams out. I did everything the way that you and I have already talked about. I would probably restore this a little bit differently, that I would restore this one with a Toffemeyer and then go back and restore this tooth separately. But this is what these restorations look like in a little more than a half an hour. And a lot less than $3,400. Okay. Another big, so this is the way I do it. I would do the big one first, and then I would do my contact sectional matrix and my contact ring. All right. I can't even remember which tooth it was, but that's what they look like when they were done. And this is an MODF restoration, and this is a DO in about 1 hour. This is an hourly employee. I used to work. I worked on a man who had, he needed an assist. So he had a MA or someone that pushed his wheelchair around. Okay. And so she was just the person that took care of him during the day. And so she ended up coming to me, but she's making $15 an hour. So there's no way that she can afford a buildup in a crown when she broke her amalgam. So we just took out all the bad tooth. This is perfectly hard secondary dentin, and we did a restoration. Okay. I know I'm making you uncomfortable, but I feel like this tooth, if it doesn't last 5 years, I usually do it again for free. I absolutely expect this to last more than 10 years. You got a crown that won't stay on. I'm sorry about how bad this picture is, but I did this DO restoration, and I did a full crown with composite. This person comes in and says, I want this tooth extracted. I said, what if I do a filling for $150 more than an extraction? Would you entertain that? And she said, yes. So I took all the decay out. I put a band in there. I held the band with my finger. This is a long-standing patient with me. And it took me 23 minutes, start to finish, to do this restoration. I told you it's going to make you uncomfortable, but I have absolutely no reservations with doing this for people, especially her. This is my hygienist, the lady that cleans her house. She was told she needed a crown. The hygienist asked me, can you do it without a crown? I said, absolutely. So I took the amalgam out, and both the buccal cusps fell off the tooth. So this is where I was at. Okay. And I knew she couldn't afford a crown. So I kept this cusp simply to keep the Toffemeyer on here. I did a little bit of electrosurge through here and did this restoration. Okay. I'm running out of time, so I really want to get to some other things. It's very difficult to do. So I don't want to undersay how hard this is, but it does take practice. And here she is, almost 9 years later, and she said the filling broke. And what she didn't realize was this was her filling, and this was not the filling that I did. She told me, oh, it broke. And I was like, no, this is the filling. All right. So on a 16-year-old patient with a tooth like this, okay, this is super thin. I did not want to cut this out. So what I start doing on my super big restorations is I put Ribond in there. A Ribond is a fiberglass mesh, and it looks a little bit something like this. And you could rebar your tooth with a bunch of strips of Ribond, and it really strengthens the tooth. And the bond is exceptional when you use Ribond. And I did a filling that looked like that on a 16-year-old, save him from a root canal and save him from a crown and a large restoration. All right, here's trouble. You're taking an impression with tooth number 19, and the crown on number 18 falls off. Okay. Take close note that there is no real tooth in here. So the only thing that broke off was the buildup. Okay. So you have a very intact, the crown still fits. So I'm going to do something called a reverse buildup. What I do, I take the old buildup out and I lube up the crown with Vaseline. Then I clean up the tooth and I put buildup inside the crown. And this is going to set up on its own. Core paste sets up on its own after I've prepared the tooth with adhesion. And I put the crown back on the tooth and the core paste sets up. Then I pull the crown off because it's lubed and I have this left on the tooth. You see the margins are all still intact. I cleaned it up because it's a little messy when you get it off of there. And then I re-cement the crown. So this took maybe 15 minutes. And then I went back and I made a temporary for number 19. You have a person that has decay under a bridge. It's a 5-unit bridge. And at 55 years old, they had money. And at 75, her husband's now passed away. And I tell her she needs a new 5-unit bridge because the distal abutment is now compromised. And she started crying. I can't afford a new bridge. I don't know what to do. So what I've decided is I know how to bond to dentin. I know how to bond to porcelain. I know how to bond to metal. I did a class 2 restoration inside the crown. So here's my restoration that's inside the crown. I used opaque layers and I blocked out the color and I did this restoration for her. Okay. And it looks like this on the x-ray. This has changed my practice. I am able to help older folks who can no longer, this is an 89-year-old man and I wanted no business. I wanted no business with him doing crowns and keep staying in my office. I just do a class 2 restoration inside the crown. And I do quite a bit on the distal part of the second molars as well, where you get decay back there somehow. And some reason I do a significant amount of these. The last restoration I'm going to show you is one of the best things that I've ever done. Okay. This person walks in. She is a spouse of a longtime patient. They just got married. They bought a 7-Eleven together. And I said, and I saw this tooth on her new patient exam. And I said, well, you need an implant. And she says, well, I can't afford an implant. And I was like, well, you need to get this tooth out and just have a retainer or something to keep the space because you don't want to lose the space. And the day that she was supposed to come in for an extraction and a retainer, I said, I'll tell you what, let me just restore the tooth. Okay.
What do you think the chances are of a guy like you and a girl like me ending up together?
Well, Lloyd, that's difficult to say.
1 out of 100?
I'd say more like 1 out of 1,000,000.
So you're telling me there's a chance?
So you look at this thing, and is there a chance? Well, the dentin is hard, okay? Hard as a rock. I'm a little bit worried about the furca, okay? But I'm going to throw a restoration on there just to hold the space. All right, so I got a little crazy with my anatomy. I got a little crazy with some opaque and colors, but I did this tooth. And she walked out the door and I said, I have no idea. I told her, I have no idea how long this is going to last. Okay. Here's the restoration. I said, this could break when you get to your car. I have no idea. So when she showed back up on a recall in a year, we took an x-ray. I was shocked that this tooth is still in there after a year. Okay. You can imagine my shock when it was 2 years. This tooth was in her mouth still in 2 years. All right. So what you're seeing in my lecture is if you can bond to it, I am almost 100% sure that it will last. I can always quantify that with my patient saying, I'm pushing the limits of this material, but I really believe in it. Okay. Here's a 3-year post-op. 3 years, that crazy restoration is still in her mouth. Okay. So the opaque layers that I put on the occlusal are all now gone. So I think she's actually occluding with this tooth. So there's no C factor, there's no constriction force. It is just the materials and the adhesive. And like I said, I use superior adhesive. So here's the 3-year post-op. I'm like, you got to be kidding. I can't believe this thing is still in your mouth. She moved away. Her and her husband got divorced. She moved to Ocala. And I basically just sent her a text every year. And I said, is the tooth still in your mouth? And she would every other year or so tell me that the tooth is in her mouth. And it just this year, I said, please come back to Orlando. I'll pay you to come back to Orlando so I can get a picture. Okay. Here is the 7-year post-op of that tooth. Okay. Here is the 7-year x-ray. That this tooth, can you believe that this tooth is still in her mouth after 7 years? Okay. So that is all I have for you. So what did we talk about? You have to know how to do the bread and butter class 2. Okay. It can be fun. They will last a long time if you use the best products. They are very profitable. Trust me. I do tons of restorations, thousands a year. And once you get the right materials and you isolate properly and you use SE Protect and you can use your contact ring and your good sectional matrix rings, and you've got an exceptional light and you're using exceptional products, these things will be great. The sky is the limit. You can do it on primary teeth, post endo teeth. You can do deep fillings. You can do big fillings. Now the crazy things like decay under bridges. Okay. If it's the distal part of a bridge. Okay. If you now can do reverse buildups. How many times do people walk into your office and say, my crown fell off and the buildup's in the crown? You're like, sit down, let's do a reverse buildup. I do a reverse buildup, cement the crown. So I get a buildup fee and a cementation fee, and it only takes me about a half an hour. Okay. So everything I do is profitable. I am not losing money on these kind of things. And I'm building my practice with successful things, and people love it that I'm conservative and they keep coming back. I told you, here is my cell phone number. Here is my email address. And I want to talk to you. I know that I've pushed the limits here, and I want to answer your questions, but it really was just a philosophy lecture, and I'm glad I was able to get it all in. So can we talk about questions? I got, 8 minutes or so for questions. Let's see here. I'm going to read you the questions. So the first question is from Marion, and they ask, do I use a crown former to get my anatomy? Okay, so the answer is no. I do it all by hand. I told you I wasn't going to talk about technique, but I can right now since I got a couple more minutes. I always use an explorer to get my anatomy before my final cure. Okay, so I'm putting in my central groove, my distal groove, my pits, all my pits in with my explorer, and then I cure, then I go in with my finishing burrs. Okay, very fast. Are curing lights usually weaker the standard ones? Yeah, the standard lights, in my opinion, are not good enough. The Valo Grand, the Blue Phase, the Valo X. I'm using a light right now, and I know what you're thinking is like, it takes too long. Well, the Valo Grand has a 3-second cure. These kind of things, you can be very efficient with your lights, and they can be very good. I'm using a light right now that I'm testing. It is a 1-second cure. And I don't necessarily believe that it's getting all a cure in 1 second, but I think at 2 seconds, I think it's working very, very well. I'm gonna Okay, so I just answered Rebecca's question. This says, do I donate my time? You know, I feel very lucky that the Lord has kind of given me this talent, and I use my talents accordingly. Like, I'm off on Monday, so I do once a month I volunteer at a homeless shelter, and then once a month I go up to the dental school to try to teach dental students how to love their job. That's what I try to do. I'm passionate about my job. I want to teach dental students about what is so great about our profession. Okay, class 2. I do have a couple minutes, and let's talk about the class 2 under a crown. Okay, so as long as you can cut a class 2 prep, if it's just a box, just like a class 2, so you can put your sectional matrix in there. Now, the bonding to things is a little tricky. So you can bond to dentin. So you're going to use your SE Protect in the dentin, but can you bond to metal? Well, Curare has a product called Ceramic Primer Plus that you can bond to metal, and you wipe that on there. Is it great? Is it great bond strength? No, but it's good. It's not great, but it's good. So at that point, you fill this up. You can use an opaque layer if you want to get crazy, because if it's a metal crown, you're going to see that metal. Now, you're helping this person not have another crown or not have another bridge. I don't think they care if it's a little gray. So you can put an opaque layer in there, but you can also bond to porcelain by sandblasting the porcelain etch, your silane layer, and then just restore. Okay. If I were you, and what I do now is I put a little dovetail in there on the occlusal. I don't just do a box. I put a little dovetail on there because that helps with resistance. Karen's asking me if I use a rubber dam. Very rarely. And if you saw, there's a couple of reasons why. A lot of my restorations are sub G, and a lot of my restorations are done in less than 12 minutes. And so a rubber dam is usually, you would say, well, you need a rubber dam for the adhesive layer. And then if you're restoring, it usually takes me about 3 or 4 minutes to restore a tooth. I think my assistant and I could keep this fairly isolated in 4 minutes. Okay. I just don't think it's necessary in my practice. Glutaraldehyde products after etch. Dr. Summerlin is asking. I use the MMP inhibitor in my primer. So glutaraldehyde is usually like micro prime. I don't really need it, okay? Because I really feel like I get everything with my SE Protect. I'm just going to read some questions. There's areas where decay is extending to the level of the bone. Wow, that is a really good question. You isolate, and he's asking me, how do you isolate effectively? Yes, I don't have any problems restoring things under the tissue. If you have a good matrix and you have a good ring and you have used your wedge and everything is in there perfectly, you get really good isolation. Okay. So that is just getting comfortable being below the tissue. If it gets too deep, you're going to have to use a Toffemeyer band, not the regular Toffemeyer, but the Getz from Waterpik or some sort of concavity in your matrix band. But if you have a Toffemeyer, you squeeze that thing down, you're getting really good isolation. What CE can you take to improve your composites? Well, you can always have your study club or your state meeting invite me. That was such a great question. Thank you for asking. Yes, I would love to speak with your study club or your state meeting. But Dr. Bertolotti is fantastic. The biomimetic classes are not meeting anymore. So just text me or call me or email me, and I'll give you the best that I know. Finishing burrs. I kind of mentioned it during the class. And that is, Mark was asking, so a 2-stripe football burr. And then my veneer polishing burr is exquisite. You get your secondary and tertiary anatomy. Okay, Karen is asking me, how do I manage incomplete caries removal? That's a great question, and this is where we're going to end. I'm afraid I'm out of time, and I don't want to upset anybody. I'm going to take, so the science says you can leave decay. Do I love leaving decay? No. So all my margins are going to be clean. All my margins are going to be super white. Then as I move towards the pulp, I'm going to get a little bit more conservative. I will use a slow speed, a round burr with a slow speed. As I get closer, then I'll just go straight to a spoon, and then I'll stop. Okay. And then I'll put Vitribond, the only thing I use. And in the science, it says you do not need a base. You do not need a liner. But I always use Vitribond. I've used it since I was a young dentist, and it's worked for me. Okay. I put Vitribond on the deepest part, and then I just do the restoration. I do not expect it to fail. Almost 99% of the time, it's successful. I really appreciate that question. Listen, guys, one last thing. I just want to thank Curare one more time. Please fill out the evaluation forms and tell me how I can improve. But I really love talking to you, and I hope that you saw my passion in my work, and I hope that you'll grade me well. And even I would love to speak to you again. Okay, so again, sorry I can't answer all the questions. I appreciate you. I hope I wasn't too fast, but again, call me or text me or email me. I would appreciate it. Thank you again for your attendance.